Hello, my name's Mel. Today I'll be talking about pharmacists' role in trans health, and I'm a fourth year pharmacy student. In 2024, the College of Pharmacists of BC, the regulatory body of pharmacists in BC, implemented a new bylaw whereby pharmacists must display this poster in areas where members of the public are able to speak with their pharmacist. This poster shows what the college would like pharmacists to enact when interacting with patients under ideal settings. The purpose of this poster is to enhance transparency and accountability when members of the public interact with pharmacists. But first, let's talk about what pharmacists do. So, when most people think of a pharmacist, they usually think of a community pharmacist. When a prescription is brought to the community pharmacy, a pharmacist will make sure that this prescription is safe and is the best medication for a person. The pharmacist may ask questions to help determine this, and if the person has never been to this particular pharmacy, a new profile will be created for them. If there's anything that needs to be changed with the prescription, the pharmacist will either change the prescription themselves or call the prescriber. The pharmacist will always check the prescription before giving it out to make sure there are no other issues. Before giving a prescription or medication, the pharmacist will counsel on how to best take the medication, what to expect, and other things that a person can do for their health. This is a very good opportunity to ask questions if you have any. Sometimes pharmacists may also follow up with their patients to see if everything is going well. For Indigenous clients, the pharmacist can also help with selecting non-prescription and also medical devices that are covered through First Nation health benefits. Pharmacists also work in other settings as well, such as hospitals and also in primary care. In these settings, pharmacists play a role in making sure all medications are safe and effective and resolve any other medication issues. Pharmacists may do this in the background or work directly with patients. So next, let's talk about what ideal standards of care are for trans people. You can expect your pharmacist to use your correct name and pronouns. Pharmacists are expected to treat people with a non-judgmental and non-stigmatizing manner with regards to people's identities, backgrounds, and medical conditions. Pharmacists are expected to treat people with respect in terms of culture, religion, and personal preference, and this happens through training, as for example, through Indigenous cultural competency, and also through continuing education. Lately, there is more LGBTQ plus content that is being embedded into undergrad curriculum, so new and upcoming pharmacists will also receive this as part of their standard training. Pharmacists also answer questions such as whether or not there are any drug interactions, how to adjust their dose, or when a dose adjustment is needed, what to expect with medications, and when you should seek medical attention. We can teach you and also help you administer your injections. We can contact the physician if we find that there are any recommendations that we would like to make and help you find ways to afford your medications. We can also provide advice and recommendations on non-prescription medications. And in BC and other jurisdictions, pharmacists can prescribe medications for a specific list of medications. For more information, you can visit the link down below. You can ask for medication counseling in a private area, or any questions you have can also be answered in a private area. If the pharmacy, when they're contacting you, is not using a private line, you can choose who information is disclosed to, if any, and also which name the pharmacy should use when contacting you. When it comes to your personal health records, you can choose a name that you would like the pharmacy and pharmacy staff to address you as, and any personal information such as administrative name and gender markers should only be used for the purposes of providing care. Let's talk about developing pharmacists' role in trans care. When it comes to trans health, there are of course things that need to be worked on. Looking at literature, pharmacists have been involved in a variety of things depending on the jurisdiction. So according to literature, pharmacists have been involved in managing masculizing and feminizing hormones, such as giving advice on fertility, making recommendations on individualized treatment plans, such as the dosing and the formulation, working with other healthcare professionals to manage interactions. For example, if a person is on hormones and they're also taking HIV antivirals. And this is all taking into consideration the person's hormone regimen and also any medical conditions that they may have. Pharmacists have also, in studies, taken a role in reducing risks when taking medications, monitoring, such as looking at lab values, and providing referrals to other healthcare professionals. When it comes to patient advocacy, pharmacists have helped in providing patients with medication access and updating protocols when new evidence emerges. When it comes to taking medications on time and on schedule, pharmacists can help with that as well. And this is very important when it comes to certain medications such as PrEP or HIV antivirals. Pharmacists have also been involved in preventative care, such as screening for sexually transmitted infections, HIV, screening for mental health, doing medication reviews by going over all the person's medications, making immunizations, and helping a person live a healthier lifestyle, such as providing advice on smoking cessation, lifestyle, diet, and weight management. So now, in conclusion, pharmacists are drug experts and expected to interact with clients in a confident and respectful manner. Pharmacists make sure that drugs received by the public are safe and effective, and pharmacists work with other healthcare professionals, such as doctors and nurses, to resolve medication problems. If you're comfortable, you can ask your pharmacist how they may be an active part of your trans healthcare team. Thank you for listening.